Let me welcome all our viewers today once again on Beyond Sugar. It's always a pleasure connecting with you live for these programs. As you are aware, Beyond Sugar is created in scientific collaboration with Indian Society of Nephrology so that we can keep on sending you information on a daily basis which keeps you updated about your health conditions. Not only we post information for you, we also invite leading doctors from across the country who can talk to you directly as a friend and answer your questions as well. I'm very glad today to welcome Dr. Pinaki Mukhopadhyay from the city of Kolkata. Sir, welcome to the program.
Oh, thank you.
Sir, a lot of our viewers who undergo various complications related to diabetes and especially the kidney problems as well. They keep on putting different questions to us, and dialysis is one subject where we get a lot of queries and questions. So today we will seek your help and your expertise to talk about this topic. But before I start talking about and taking the questions from our viewers, let me formally introduce Sir to you. He's one of the leading nephrologists in our country, one of the most senior ones. And after doing his super specialization in the field of nephrology from prestigious PGI Chandigarh, he has been serving his patients who come to him in the city of Kolkata. He has a huge experience. He has also written around 18 original articles in national and international journals, along with various other abstracts, and also has 4 chapters in the textbook. So we know that we are talking to someone today who's an absolute expert on the subject. Currently, Dr. Pinaki is working as professor and head Department of Nephrology at NRS Medical College in Kolkata. Sir, let me straight away hand it over to you now for your opening comments. And maybe, to begin with, you can let us know that, when we talk about dialysis, so who are the patients who really need, dialysis, and at what stage of kidney disease you recommend this to the patients?
Yeah, that is a very basic questions because who needs dialysis? Because we have actually treat the two type of patient. One group of patient is called acute renal failure patient. This is called acute kidney injury, and another group of patients that we actually treat that is called chronic kidney disease. So, in case of acute kidney injury, where there is a really need, there is a rapid rising of the creatinine, there is a hyperkalemia, there is a metabolic acidosis, fluid overload, or there is a worsening symptom in the form of uromic encephalopathy. So, whatever the cause is there, the acute renal failure is actually need for emergency dialysis. Not only to support the kidney, but also to control or take care of the metabolic control of the kidney. So, most of the cases after the few dialysis, if the etiological cause is being corrected or treated accordingly, they will revive, and most of the cases they are revived back to his normal renal function. But few of them may lead to the AKI to CKD conversion, but most of the cases patient is recovered. But another group of patient which is known as the chronic kidney disease, following the diabetes, hypertension, or other glomerular disorder, they actually suffering from CKD 1, 2, 3, and then landed to the ESRD or CKD stage 5. When this group of patient is actually having a symptoms, or patient is having a low urine output, hyperkalemia, metabolic acidosis, uremic encephalopathy, or uremic pericarditis, or the fluid overload. These are the cases we actually have to start in dialysis, and this type of dialysis is uh, to be continued for the long time, and sometimes it is a lifelong, and this is actually the means for your maintaining this life. So that is called the maintenance dialysis. But this dialysis may not be always the hemodialysis. There is another group of dialysis called peritoneal dialysis, where actually dialysis takes place by means of the glucose or fluid. So anyway, when the patient is actually suffering from the CKD stage 5 with the symptoms, definitely they need dialysis for long time and lifelong.
Okay, so basically, Dr. Pinaki explains for us that individuals who have chronic kidney disease and they have progressed in their disease and they are now at stage 4 and stage 5, so they would be the ones who would be requiring dialysis. And when your nephrologist, when your doctor advises you dialysis, it means that that now probably the basic medications are not working and you really need that. So, are there any, just for the understanding of the patients and the common man, are there any, particular creatinine levels you see or some, filtration rates that at after what level you actually say that okay, now dialysis is the most important option.
Yeah, there is a very basic questions because initially it was thought that when the creatinine is raised, they need dialysis. But in a true sense, creatinine is not the indication for the initiation of the dialysis, because in many cases we have seen the creatinine is very not much high. It is a modest, but the patient need dialysis for the different reason, because patient maybe have fluid overload following the heart failure, or patient maybe have poisoning, who actually the dialyzable poison is there, but the creatinine is not, may not be the criteria. But the basic belief or basic practice is that when the creatinine or the GFR is declined less than 15 and is a persistent more than 3 months, when actually you declare the ESRD, then actually the dialysis starts. But in case of the AKI setting, where the creatinine is not the actually the criteria, but the symptoms associated features in the form of hyperkalemia, metabolic acidosis, encephalopathy, or fluid overload is actually the indication for the initiation of the dialysis.
Okay. So for our viewers, it's like many of us, we just look at some of the reports which are easily available to us, just see what is the creatinine level and think whether, this is required or not. But here you need to be trusting and going with the word of your doctor, what he says to you. And there are a lot of other factors basis which they will decide whether the patient needs dialysis or not. So now, when someone is put on dialysis or recommended to be put on dialysis, and today's program is going to focus on some of the myths and facts. So there are a lot of doubts or questions people have in mind, and one of the thing which comes at the top is that now I have been asked to go on dialysis, and this is the last stage of my kidney disease, and there are he's really worried like that, what's going to happen now. So is it true? Is it the last stage of kidney disease, and now there's no future?
No,
What do you
no,
think?
this is absolutely myth, because whenever, because many of us, the patient, out of this ignorance of the things, they think that is when the dialysis started, they actually think himself it was the end of life. But actually the dialysis actually increases the life, it prevents life, it gives add on the life. And many patients who actually they have started on dialysis not for the ESRD but the acute renal failure, which is totally reversible, and patient can lead the light even in the normal renal function after the few sessions of dialysis. Second thing is that few patient who has already in chronic kidney disease but suffering from acute insult with the form of the sepsis, they are called acute and chronic kidney disease. They may require few sessions of hemodialysis, but still they can lead life for a long time without hemodialysis. And the last important part, who actually already in SRD on maintenance hemodialysis and we actually require dialysis for long time, there is don't worry, and there is no thinking in the process that is the end of life, because with this some lifestyle modification and thrice weekly dialysis, they can live life longer with some greater quality of life. So this is a myth, that is the dialysis is the painful, dialysis is the end of life, and if the dialysis start, dialysis should be continued for ever.
Okay. So I think he clarifies for all our viewers, it's not end of life. It is basically to improve the quality of life for the patients and to add more years to the life. So although you clarified this myth that that to AKI patients also you give, but then a lot of people feel that once on dialysis and then now you would be always on dialysis throughout the life. Is it true in majority of the cases, or what's your guidance around here?
Yeah, because very few cases where actually we have seen also, that is patient having a suffering from the acute renal failure, or they have no underlying diabetes, hypertension, or there may be some poison patient. So 10 to 20% of the patient who may not total recovery from the AKI, so they may can land up to the CKD, but there is a devoid of dialysis. But 1 to 2% of the patient of the AKI who cannot recover for any time, so they may can continue as a dialysis for long time. But it is mainly very few. It is not for the majority people, but majority people who actually dialysis is for that is few sessions and only just recoverable time to get the recoverable time of the kidney.
Okay. Sir, just a linked question to this. Those patients who are with chronic kidney disease and they are on stage 4 or late stage 4, early stage 5. So once you start dialysis on them, so how long they can, sustain on the dialysis, and does that, really, make up for the time that towards their kidney transplant? So that's one very common question we get.
Yeah. Suppose the patient, actually we don't start the dialysis in the stage 4. Actually dialysis is indicated in the secondary stage 5, and by definition it is called when the decline in the GFR is less than 15 and lasting for more than 3 months, they are called DSRD. And the patient is actually usually started on hemodialysis. And then two group of patients are there. One group, they actually want transplantation, because transplantation, renal transplantation is a better modalities and quality of life is good, and so it is a most accepted thing among the renal replacement therapy. So who actually willing for renal transplantation, they actually shifted to renal transplantation for the donor workup. But who actually they have no donor with them, they have to stay on hemodialysis. If the patient take the adequate dialysis in certain center and maintaining the your uh, uh, lifestyle measurement and some kind of maintaining the hemoglobin level and dietary instruction, actually with this dialysis they can spend more than 10 to 12 years also. So
Okay.
dialysis is not that is it is the end of the life. So I always think, always tell, always improvise yourself, that is keep yourself healthy with dialysis. So what is the theme is there, what is the take home message is there, one can stay good even with the dialysis.
All right. So I think that should build the confidence of a lot of our viewers that you can actually sustain for 10 to 12 years as well with the help of dialysis and have a good quality of life. So another question, which is generally asked is that people feel that for dialysis they have to be, hospitalized, and if not hospitalized, they have to go every other day. And whether these expenses are covered in the hospitalization expenses or not. So there are a lot of doubts with related to this. Can you help us with the facts here?
This is another myth is there. It is dialysis is expensive. Uh, Rightly, that is dialysis is expensive modalities because it needs machines, it needs expertise, it needs infrastructural support. But nowadays, as it is a the CKD is increased, and the government is came forward and they actually put many jojonas, Pradhan Mantri Jojana dialysis technique, and also the state government also came forward, and the insurance committee and insurance agents also make it included in their uh, treatment modalities. So nowadays, majority of the states are make the dialysis free, and even in the private sector where the dialysis is there, they also taking in the Ayushman Bharat or the Swasthya Shati Prakalpo, so they also give the dialysis free of cost. So nowadays dialysis is no longer is expensive if you can go right place, and you can just register yourself in a right way. I think it will be get free, so it is no longer is a financial burden to the family.
So I think it's simply said, so as Dr. Pinaki mentioned, it's a life-saving procedure. Can add a lot of years to someone's life, and it's not unaffordable. It's
Yes.
manageable, and there are many places in within your nearby to your city, within your city, which will be government funded, which will be covered under various programs. So go and find out where you can register yourself. Sir, how about hospitalization? Does it require hospitalization, or it's a daycare therapy? How often someone has to visit the hospital for getting the dialysis done?
Yeah. Regarding the emergency dialysis, suppose the patient is suffering from sepsis or suffering from any other disease, there is a GFR is suddenly declined. The patient is actually suffering from the AKI. So hospitalization is there because patient is being hospitalized for other reason. When actually is diagnosed as the AKI, then for he has to give dialysis within a hospital. But the patient who has the CKD 5D or there is a maintenance hemodialysis, sometimes hospitalization is not required. The patient is actually as a daycare basis, they will come get dialysis and get discharged from there. And there is another modalities of dialysis nowadays. It's called home hemodialysis. You can keep yourself all the apparatus, that is a RO water and the hemodialysis machine at home, and you can do the dialysis at home. So hospitalization is not mandatory. You can also register yourself in some centers. We can go and the daycare basis, or even you can afford, or some infrastructure can support yourself. You can take the home hemodialysis as well.
Okay. So you don't basically a patient doesn't need to be
No.
hospitalized in most of the cases, and there are procedures related to peritoneal dialysis as well, which can be done at home. If you ask your doctor, I think they would be able to help you and guide you. Sir, another, one of the stress which such people have is that now my doctor has asked me on the dialysis to be on the dialysis, so now my life is restricted. I can't be leaving my city, I can't travel, my day-to-day work will be hampered. How do I go to office if I have to come for 2 3 days in a week for dialysis? So what are the solutions here, and how do you guide such patients on this thing?
Yeah, that is a very important questions, and question for the every patient actually who actually entered into the dialysis, because you have to take the dialysis 4 hourly, thrice per week. That is a 12 hours. You have to spend yourself for the dialysis. Definitely, it is a chunk of your time from your life is being diverted from that. But the thing is that if you think philosophically in the different way, if you take dialysis 4 hourly for 3 per week, because you have get a lot of time to maintain your office job, to maintain your, because quality of life is improved. So sometimes there is a loss of job, loss of financial uh, agreement, and as the patient is actually registered in the dialysis. But you can change your job according to feasibility. You can change yourself lifestyle according to the your schedule, because some centers they do the night dialysis. So you can take the night dialysis, you can take the job in morning. Second things, some other group of dialysis called the peritoneal dialysis, called automated peritoneal dialysis. So you can take this dialysis at home, and in the morning time you can go your office, you can make your company, you can go everything, and you can do everything. So that is the what is your profession, what is the nature of the work, accordingly you schedule yourself in the dialysis and the dialysis modalities. In this way you can manage your work, and you also the manage your financial burden.
No, I think, sir, thank you so very much. This is a very important guidance and confidence which you have given to all the patients and viewers, that they can manage and how they can do it. So one of the another question, which we get is that since there are a lot of infusions and multiple times it has to be done, so it may lead to infections as well in patients which are regular in nature. Is it true that can that happen? And if that happens, are there any mitigating strategies which you advise to your patients?
Yeah. What happens actually is the patient having the ESRD, that is the immunity power is decreased. So they are much more prone for infection. And another group of things, as the patient is actually hemodialysis, there is a puncturing, or there's an accessing for getting the blood and going to the dialyzer and then revert back to the. So that is may can cause infection. But with some aseptic care, good center, with the good protocol, the infection rate can be reduced a lot. Second important thing is that the patient who is already peritoneal dialysis, they have to be monitored very carefully about the all the steps where the sepsis can spread. So putting this all step, and with a good surveillance, the infection rate can be decreased. And another important thing, if the in spite of the infection, if you take care of the infection early and also start antibiotic accordingly, I think this infection can be managed very better way. So infection is not any things that can lead to the debut from the dialysis. But the thing is that infection rate, sometimes the infection is called CRBSI, that is a catheter related bloodstream infection, that is much dreadful condition. The patient is actually put on IJV or some pump cath. There may be some infection is there, but that can be managed accordingly if the centers are very much vigilant on that and can start treatment priorly.
Okay. So, so listening to your answer here, I'm also tempted to ask you that does the choice of center makes a difference or matters for dialysis or the rate of infection? Because we see different kind of centers. There would be corporate hospitals, there would be government hospitals, there would be some charitable people also who will be doing free of cost or at very less cost. So, does the choice of center matters for the safe dialysis and the outcomes related to it?
Yeah, because it is called the center policy, or they call center excellence. Definitely, if the center actually maintain some strict SOP, and they actually monitored all the patient regarding the spread of infection, mainly that is hepatitis C, hepatitis B, and also the gram positive infections, because this type of patient actually get the blood. So blood is the major source for the hepatitis C infections. So the centers which actually used the separate machines, they can keep vigil on the all the patients, and frequent monitoring of the serology. Even the patient is actually treated the adequate treatment according to the culture protocol. I think infection can be reduced, and infection related death and infection related comorbidity also is been reduced. And definitely it depends upon the center and how they can practice with the changing of the gloves, and also the training of the dialysis technician, and also the monitoring of the strict monitoring of the dialysis. So definitely centers matters.
Okay. So I think different, as Dr. Pinaki mentions, different centers will have their different protocols, how they uh, do the dialysis, at what frequencies they change or upkeep their equipment. And I think that somewhere also impacts that the what's the cost of treatment or cost of dialysis as well over there. So whenever you are making a choice, please make an informed choice that where you are going to get your dialysis done. Uh, Sir, since we are also running out of time, so I'll just ask you, one final question on this. And this is a very, I mean, for a person of your expertise, I don't even know whether I should be asking this question or not. There, a lot of people feel that, okay, dialysis, you have to do the filtration, so drink a lot of water, and, this will help you improve the filtration as well, and, cleaning the overall body system. Uh, what kind of statement is it? Is it a true, false, fact, or how do you
This
take
is
the.
a very common question, and majority of the patient in our country actually they are believe if we take much more water, so all the impurities or the metabolites they've been cleaned out by the kidney, and definitely our kidney will not fail, and that kidney definitely will uh, do better if you're taking the much more water. That's 4 and 5 liter per day. Even in some people, they are actually practicing to take the 2 liters in the water even in the before breakfast. So there is a belief, but it is absolutely wrong. Why? Because for our metabolic needs, that is 2.2 to 2.5 liter is water is enough. And some patient who have maybe a incipient heart failure, we don't know, but if you practice this much more water intake, that will cause precipitation of the heart failure. Third important thing is that water intake is depend upon the actually the water what is the actually the your profession. Because the patient who is actually cultivator who actually work under the sun, definitely there is some much more water is required, so he can take the much more water. The policeman, the traffic guard, they actually they can work, they work under the sun. But the corporate sector which actually work on AC, they does not require any much more water. So excess water is good for health is not true one. So what is the take home message is that take the water adequately and according to the profession, according to the need. And if the patient is already declared CKD, because already kidney is compromised, if the much more water is taken, what happens actually, compromised kidney has to work much more work against is the load, so your kidney will fail much more faster. That's why we have to adequate, or we have to limit the water intake up to 1 to 1.5 liter, or according to the situation demands.
Okay, I think this was a very, very important clarification, and good that I asked you and you could clarify to our viewers. I think Sir has today really, taken some of the very, very basic questions also which we asked today from the viewers or the general public point of view. Uh, to a person of his expertise coming over and answering some of the very basic questions. I must thank you, Dr. Pinaki, for this today. But before I conclude the program and say thanks to my viewers, I will give it back to you for your closing remarks. Is there anything important which is for the people to know and which we have missed, and you still want to emphasize? You can please let us know about that, or if you would like to say a few points in the summary.
Yeah. uh, for all my viewers, I want to convey these things because whenever the patient actually came to know that is both kidney are actually lost forever, now they have to live on dialysis or the renal transplantation. There is a severe setup. Uh, there is a depression is going on. So sometimes it is so extent, sometimes they are so much afraid to start the treatment, so they are very much reluctant to start or initiate dialysis. What happens actually, if you start dialysis late or very late, so they will end up on the some cardiovascular problem. And uh, if the you start the dialysis in right way, right time, so you can also avoid many problems later on. So if you consult your doctor, if they are tell to create a V fistula, do the V fistula, your doctor will suggest when to start, ideal time to start the dialysis. Go with the uh, your doctor and start the dialysis, because this will help in later on, and that will add on life. Because we have seen many patients, that is the we have actually start dialysis but start dialysis late. They have a lot of problem regarding these cardiovascular events. There are a lot of metabolic parameters, anemia, even in the early death as well. But some centers, early versus late, there's no definite changes. But the thing is, dialysis should be start when actually indicated, and that should be continued, should be monitored, and always improvise yourself, that we can live our life much better with dialysis.
All right. So I think on that positive note and your thoughts, we will conclude this program. I think the message is very clear from Dr. Pinaki that dialysis is not end of life. It is given to improve your quality of life and add years to a patient's life when it is recommended. And also, he clearly mentions that that we need to be careful on choosing the right centers, and he has busted a lot of myths today on subjects related to dialysis. I hope this conversation would have been useful for you. Now, if you know anyone in your family or in your friend circle who is having a chronic kidney disease or who is having diabetes and may develop kidney disease later on, who may need dialysis, you can simply share the link of this program with them, and today's conversation with Dr. Pinaki can be very, very useful for them to gain an understanding about dialysis. If you live anywhere in Bengal or in the eastern part of a country and you need more information, you can always visit Dr. Pinaki Mukhopadhyay at NRS Medical College. But if you are listening us anywhere else in any other city, please don't delay these things, these decisions. Have a word with your nephrologist whom you are meeting, and take your decisions as fast as possible. So with this, we thank Dr. Pinaki to
Thank
you
you.
for joining us today, and we thank all our viewers who joined us live or who would be watching us later